Good afternoon once again. It's a Friday afternoon, Friday, April 5. I'm Cliff Hughes.
And I'm George Davis.
Well, key government and health sector stakeholders are at this hour locked in an emergency meeting at the Ministry of Finance. This as the health sector continues to reel from the absence of close to 60% of the island's doctors for a second straight day.
Professionals from the Medical Doctors Association, the Association of Government Medical Consultants, and the Medical Association of Jamaica have been on sick out since early yesterday morning. Speaking on Nationwide's This Morning earlier today, the president of the Medical Doctors Association, Dr. Dane Miller, says the country's health sector is in shambles.
You are in a clinic and there's no running water.
No running water?
Yes.
Like where?
I have in the Kingston region. I cannot say exactly, but I have heard that, doctors have been to clinic and, there's no running water. They have to use a pitcher and somebody pours the water and they wash their hands that way. There are limited or no bathroom facilities for doctors. The conditions out there that our doctors and our patients endure are substandard. Sometimes you don't have needles. Sometimes there isn't Panadol. Sometimes there aren't the required drugs. You put patients at risk when you don't have these things.
So what do you do? What do you do when you don't have needles and the patients come, doctor?
Well, you wait until you get needles or you improvise.
What do you mean?
You find other ways. You may use a branular, which is an IV, and you might decide to administer medications that way.
Dr. Dane Miller, president of the Medical Doctors Association, speaking on Nationwide This Morning with Emily Crooks.
According to the Ministry of Health, doctors remain off the job in most hospitals and health centres, with a greater level of absenteeism today than yesterday. The Health Ministry says data indicate a 55% level of absenteeism today compared to 42% yesterday. The Health Minister, Dr. Fenton Ferguson, today toured several hospitals in the southeast region. Well, he was set to join us this afternoon, but apparently the pressure is on. He's locked in that meeting, as well as the Public Service Minister and the doctors trying to resolve the situation that is now crippling the health sector. Well, the nurses play a crucial role even when the doctors are present. So when the doctors are not present, their role is even more critical. The president of the Nurses Association of Jamaica is Antoinette Patterson. Good afternoon, Ms. Patterson.
Good afternoon, Cliff Hughes and Mr. Davis, and to the listening public. Thanks for the invitation.
You're welcome. Now, what is happening in the hospitals across the island?
As we speak, the nurses across the length and breadth of Jamaica have been delivering the highest quality of care that they have committed to deliver. So they are, in fact, doing the job that is expected of them.
But given the absence of the doctors, what kind of additional pressure are they under?
Might I first of all say that the Nurses Association of Jamaica wishes to express get well wishes to all doctors who are ailing at this time. We as an association wishes for
Hold on, Miss Patterson, don't bother with it here.
But let me tell you.
Don't bother with it here.
But we have to wish them they're sick.
Get well messages?
Get well messages to the doctors. They say they're ailing.
Well, we are not sick, Miss Patterson, and we know that.
They say they are. And
you believe them?
I do. I believe sick is, remember that sick is an objective thing. It is not subjective.
Really?
It is not what you can see.
Yes.
So therefore, you have to take what the patient says.
And therefore,
the doctors are saying that they're ailing, and so the Nurses Association of Jamaica wants to wish them speedy recovery. However,
Miss Patterson, hold on.
Yeah?
You're asking us to believe
I'm not.
that some affliction has suddenly come over up to 60% of the island's medical doctors in a matter of hours. Mm-hmm. So much so that they cannot tend to their patients across this island? Do you want us to believe that?
It is unfortunate that an ailment has come upon our doctors
and
that within few hours, all of them are succumbing to the same ailment.
And how are our nurses immune from that ailment?
Our nurses are immune from that ailment because we do not all have the same level of our immune systems are not compromised in any way.
Let us stop the crap.
In other words, you have your reclassification already. The doctors don't have theirs. That's the
Really,
immunity,
they
Ms.
do?
Patterson.
I'm
No, they
unaware.
don't. They don't. That's the point.
However, let me explain to you. It is unfortunate that the conditionalities of which doctors speak that has promulgated them into a sick leave mode at this time. It is quite unfortunate. Might I also say that reclassification is not yet implemented. It is scheduled to be implemented as of the 1st of April. And it is quite unfortunate that it has not yet been implemented and they are having side effects. It is sad.
So tell me no.
George, I am not going to continue with this charade because it's not an ailment. It's a form of industrial action being taken by our doctors.
Yeah.
However legitimate or illegitimate, it is a form of industrial action. And let us call it what it is. Mm-hmm. It is no ailment. It is no affliction. And we need not do that because that is not true. The doctors have, from their perspective, a genuine complaint. Let us say what it is. Isn't that so, Miss Patterson?
The doctors have made a number of claims. One, they have alluded to the fact of conditionalities of work, which is not a new concern. That matter has already been discussed by all the other members of the health sector. In fact, the 26 groups in the health sector have been discussing that with the government. The Ministry of Health, who has overarching responsibility for our health system, is currently looking at the conditionalities of work and is intended on addressing them. So it is quite unfortunate that at this point that the doctors are now falling into sickness because of conditionalities of work.
Ms. Patterson,
yes,
give us a sense of what's happening on the wards across the hospitals now that up to 60% of the doctors are off. How is this really impacting on the delivery of health care?
It is not impacting significantly in the lives of the nurses, simply because the professional nurse has a duty to do, and she does her duty well. Bearing in mind that the service that we provide is one that is autonomous and collaborative. While that group of individuals are not on the job at this time, the nurses are doing their duty.
So the minister is telling us, it's up on the break. Can you stay with us until after the break, Nurse Patterson?
Sure.
Okay, President of the Nurses Association of Jamaica, Antoinette Patterson.
Welcome back. We're speaking with the President of the Nurses Association of Jamaica, Antoinette Patterson, trying to get some of the other key stakeholders in the health sector, but they are at the Finance Ministry at this hour, locked in a meeting to resolve the issue. Doctors been on sick out since yesterday morning, and it has caused some disruption to the delivery of services in the island's hospitals.
We should also say that the Health Minister has told our news centre to advise you, the members of the public, that if you are very ill, you should still make your way to the public hospitals because there are doctors still working in the system as well as other professionals. So you should not stay at home if you are very ill. If you don't need to be at the public health centres, well, don't go there because they are already under pressure as a result of the industrial action being taken by the doctors.
Mrs. Patterson, yesterday in the House of Representatives, the Health Minister, in response to a question from his opposition counterpart, said that an emergency protocol had been activated. Now, we wanted to give us an idea of how this emergency protocol is being facilitated given the absence of key personnel, the doctors, who would be leading the charge, supported, of course, and very ably so by their nurses.
Might I just share with you that the key players in the health sector includes the nurses. The doctors spend the least number of hours with the patient. Mm-hmm. So while they play their part, their absence is not that significant. Bearing in mind that there are contingencies in place. For instance, the consultant who manages a firm comes to the institution, makes a decision, which they normally do on a day-to-day basis. Mm-hmm. They come with the team, do what they have to do their ward rounds, make their orders, and leave. So it's not strange that these doctors are not there, nor the consultants are not there. They're really and truly, the nurses really and truly do not miss seeing them, because the consultants come, do what they have to do, make their orders, and the nurses take care of the patients.
I am a little surprised by your choice of words, Nurse Patterson, because if that is so, we can do without them then. Why we don't do without them permanently?
Yes. Why would we can't do without them? I did say at the start of my statement that they play a part in the health sector. There are 26 groups that impact in the health sector, of which doctors are. The doctors come to the first professional that you see when you enter a health facility is the nurse. The last you see when you're leaving is the nurse. The doctors visit for a few hours, then they go. That's what happens.
But their diagnosis and prescription are absolutely vital to nursing care.
Yes, it
Your
is.
service is complementary.
But
without theirs, you ain't going to get better.
They are going to get better because, as according to the health minister, that there is contingency in place, which simply means that there's a doctor who is covering for them at this time. So if there is a situation where a patient needs a prescription, that consultant is called to come and make that order, and then the nurse will go from there to administer whatever medication and continue the care of the nurse.
But Mrs. Patterson, all right, so with approximately 60% of the island's doctors out of service over the past 2 days, how long do you think this situation can hold for without the kind of disruption that one would believe is happening now in the service?
I'm unable to say how long it can last, but bear in mind that the president of the JMDA spoke passionately, saying he's unsure of they can be sick for a day or 2 or 3. We cannot predict how long this will last. However, I'm alluding to the fact that what normally happens is the doctor come in the morning, they do their ward round, they make their order and leave. And that's exactly what the consultant is doing now.
But what I'm trying to get at is if for the next 5 working days, starting Monday to Friday of next week, the situation doesn't change, your colleagues remain sick, your doctors remain sick, the nurses could continue as they are with the services of those consultants who are part of the emergency protocol now? Is that what you're saying?
That's exactly what I'm saying, that the nurses will continue to work with the consultants who must come in once the junior doctors or the senior resident is not coming. It is mandatory that the consultant takes the call, and it is mandatory that the contingency plan that is put in place is followed through on.
And the consultant would come in and do the rounds that the junior doctor would have done?
Sure.
Okay, so he will cover 24/7
He will.
for the junior doctor.
Yes, he has to do that. It's his responsibility now.
But surely they can't carry on indefinitely.
Well, the decision is left to the junior doctors to decide on whether or not they want their boss or their senior personnel to be carrying the bulk of the work.
The other issue, Ms. Patterson, concerns the statements made by the MDA President, Dr. Dane Miller, earlier today about the overall conditions in the island's healthcare facilities. I remember very well, I think it was 2005, I spoke with your predecessor, Ethel Anderson, who spoke about having to send to Chinaman shop to buy bleach. I remember it very well.
Yes.
And all little necessary things that were needed in the health facilities. Is that your experience? Is it the same? Is Dr. Miller onto something when he speaks about an absence of needles, Panadol, etc.?
More recent than that, in 2007, we had to call the media attention to what we had at KPH, where we had difficulty with having resources. It's not new, but what he's alluding to now, most of the things that he made mention, they're not happening now. It's something of the past. For instance, he made mention of no running water. I'm not sure where that is happening.
And he said the Kingston region.
But that's not true. I have no evidence of that. When I heard the newscast this afternoon about it, I went on the phone to call all my facilities, all my nurses, to say, can you give me a date of when this happened? What I do recall, however, is that if there's a challenge with the water system, it is communicated to the various institutions, and the ministry makes provision or put in measures for us to make sure that we have water to cover us for that period. Whether it is going to be trucked or you're going to be informed to store water. So I'm kind of taken aback to say, why would he make mention of that, which really does not exist?
And so when he describes the service, the health system as in shambles, would you agree with that?
No, the health system is not in shambles. It is not in shambles. At this point, we have difficulties, which we are already discussing with the government. And in fact, the Minister of Health has committed to address these concerns. It will take some time, and we understand what is happening. And so while he's pulling on to this as a reason for them to be ill, it really doesn't hold water.
No,
So
he wasn't
hold on,
saying there's a reason, you know.
So hold on, Mrs. Patterson. He's misleading us then.
I'm not sure if he's misleading. He's trying to garner some support for the reason.
And in doing so, is guilty of exaggerate, of exaggerating.
Because I'm unable to find. I'm saying this on the ground that I called the institutions to find out when was the last time that we had a week long of having no water where anybody had to be pouring from a pitcher or pouring water to somebody. That's not true.
Absence of needles and Panadol, Miss
That's not
Patterson?
true. There's no absence of no needle or no Panadol.
Or shortage of
But
needle and
you must
Panadol?
understand. Let me just explain something to you. That since we have what was called the abolition of this user fee policy in 2007, our stocks that we have been significantly compromised because of the influx of patients. And so from time to time, your stocks will go down. And the difficulty in getting back these stocks can pose a problem, but it will never last. And it is never over an extended period.
There's talk, Mrs. Patterson, that, look, some doctors looking and seeing some nurses based on their own reclassification exercise are now drawing down more than them. And it's a case of professional envy, it may be, although a worker's in a different class. And that's what has pushed them to this point to be sick as they try to advocate for an improvement in their circumstances. What do you make of that?
All right. First of all, what I make of that, like you term it as professional envy. Well, the Nurses Association of Jamaica termed that as professional terrorism, and that is wickedness in high places. You must understand that with reclassification does not necessarily mean an increase in salary. It could mean that there's an increase in your position. And so, with a reclassification that has been started by the nurses, it was the nurses who called for reclassification in 2005.
Yes.
It was the nurses who had a number of public education campaigns. It was the Nurses Association of Jamaica who was sent to the Ministry of Labor. It was also the Nurses Association who was sent to Industrial Dispute Tribunal, where we paid $1.5 million to garner a lawyer to support us while we were at the tribunal. And so with reclassification now concluded December 2009, it is quite unfortunate that these doctors who have signed to accept the review of the panel and have accepted that document, and now when it is time for implementation, that they're falling sick, the side effect is that they're sick. It is utter rubbish and professional envy and professional terrorism, and they need to stop it. Secondly, they need to understand that there are different levels in nursing, and the beginner nurse will not get the pay of a beginner doctor. It is our dream, and it is the Nurses Association of Jamaica's dream that all nurses would get more than the doctors, because in truth and in fact, the nurses do more work than the doctor, and so it is our wish. However, that wish was not granted. Might I also share with you, sirs, that the level nurse that will be on par with the doctor is a nurse who has advanced training. And so it is quite sad that the same nurses that these doctors are envying now are the same nurses who have taught them to cite an IV line, who have taught them the understanding of drugs, who have taught them to do a number of things, and have to be standing in the gap for the patient. The nurses are the patient advocate, and these doctors need to understand themselves that while they play a role in society, so is the nurses, and the nurses are equally educated and more educated than some of them. They have not done anything other than the mere medical course that they have done. The nurses who will be on par with them have gone through numerous training. We've started at level 1 to level 10. Our scale has been shrunken to 8 levels. And the level to which these doctors are now complaining, where the nurses will be getting paid, they should be at level 1 with the level 1 nurse. The nurse is coming out of training. I cannot understand why these doctors are behaving like that. They must understand their position, that there's a place for everybody and there is enough money for everybody to get.
So bad mind, Mrs. Patterson?
It is bad mind. It is professional terrorism and envy, and they need to stop it. We all work together, and had it not been for the nurse, some of these doctors would not have been able to perform the way they are performing, and they need to stop it.
What do you mean by that? What do you mean they would not be able to perform the way?
I'm telling you that there's no doctor who can go into theater to do any procedure without a nurse there.
And no nurse can go into any theater
The nurse would
without
not
a
go in
doctor.
there because the nurse knows her limitations and the nurse knows her scope, and so the doctor must understand that we work side by side.
But listening to you for the last 4 or 5 minutes, Mrs. Patterson, it wouldn't seem so. It seems like the nurses are the ones who really lead and are in better...
They run things.
Yeah.
But of course, because we're there 24 hours.
Oh?
We are there more than with the
And you
patient.
teach the doctors how to do what, the IBU...
When the doctors are in training, and I'm telling you that when the doctors are in training and they come to the health facilities, it is the nurse who teaches them to sight an IV line. It is the nurse who teaches them a lot of things. If a doctor comes to the ward to find out what is happening with a patient, it is the nurse who tells them exactly what has happened overnight and what is happening at this point. They rely heavily on the nurse's assessment.
And the nurses rely heavily on the diagnoses of the doctors, don't
The
they?
nurses do make their own diagnoses.
Excuse me.
They do make their own diagnoses based on the problem that presents, and they decide on exactly the treatment protocol or modalities for these patients.
No.
And that is why we have invested in our nurses the right to question any order that is made by a doctor. A doctor can make an order for you, Mr. Hughes, and the nurse will say, no, that patient cannot get that order. It is a right of the nurse to question the order.
As we leave you, Mrs. Patterson, the doctors 2 days sick out. Based on your history of public education exercises, you could teach them a thing or two about how to get their pound of flesh without coming off the job, eh?
Of course. The doctors need to understand, you see, they need to understand that until they appreciate where we are in life, that we are on the same tangent, we're the same humans. And if all our nurses should call in sick today, hospital would even close. We can continue the service that we have now without them. But if our nurses should all be pulled off, it will be pandemonium in the society. And so we want the doctors to understand that they need to leave the nurse's salary alone. The medical doctor who is coming out of training should be getting a pay similar to the registered general trained nurse who is just graduating from the training institution.
Mrs. Patterson, you're the president of the Nurses Association of Jamaica. You have delivered a blast. Thank you.
Thank you very much.
Thanks for having me.
I'm sure we'll be hearing from your
Your doctors.
colleague doctors.
Yes.
That's the cover story.